Welcome everyone to the Body Electric 2.0. I'm thrilled to have Rosemary Bourne, who is become a friend and a colleague, and she does wonderful education and trainings through her work with color puncture. And today we're going to be talking about tracking the cause, applying esogetic therapies in clinical practice. So welcome, Rosemary. It's really an honor to have you here.
Thank you very much for having me, Christine. And I also want to say a hello to all the people that are going to be listening. And I hope we're all going to learn something today.
Yeah, we absolutely will. And you have such a depth of knowledge and such a unique tool that you have to share with us, and so much clinical experience behind this. And so I'm just really honored that you're taking the time, and so people can really learn about this system of healing. And my goal with the Body Electric 2.0 is really to share this realm of energy, frequency, vibrational healing. And there's so many modalities out there that can really accelerate one's healing and really get to the root cause of some of these really chronic issues that we see. And so can you just start the conversation and talk about some of the general concepts in the esogetic approach to treatment?
Yes. Okay, great. So let's have a look at the first slide. So I just want to start with the very, very, very basic understandings in the system, which is that we're working with 3 layers of information here. And so when we're looking at a client, and also when we're using the evaluation techniques, we're looking at 3 levels. So the causative level is the information field. And by that, we mean the subatomic holographic biophoton light field. And we know that in the hierarchy of the system, the physics of light sets up the chemistry in the body. And the other thing that we understand about information, or what we call spirit mind, is that it exists outside of time and space and is not bound by this dimension. And we also, in the esogetic system, when we talk about this information field, in terms of us, we're also thinking about our own flow of information, and meaning, who are we and what are we here to do and be? And how do we stay connected with that? So that's the kind of, we say information rides on energy and informs matter. So this is the tribunda here. So energy and the soul psyche we see as the transporter of the information, and it creates the dynamism which brings matter to life. And energy, in the way we see it, is very much connected with the psychology. So even if you just think about the way the psyche then programs the breath and affects the channels in the body, we see how energy represents the kind of the dynamism between information and the body. So then the matter level is the cells and the biology. So these are the 3 levels that we're looking at in terms of making an evaluation. Okay, so let's look at the next page here. So then when we think about disease, we could say then that every disease is a form of misinformation that affects matter through an energetic effect. And in Peter's understanding, there's a vibrational rhythm between the cellular and the energetic functions. We call this the cellular oscillation. And through observation of patients, Peter noticed that physical malaise and disease are already energetically present a long time before the individual is confronted with them. And this can be visualized through the photographic phenomena of the energy emission analysis device. So one of the key statements in the way that we think about illness and disease is that everything develops energetically from the subtle to the gross, and nothing just occurs. And so, to some extent, also, when you think about how you recover from an illness, you also develop out of an illness. And I think that's something that's important for people to understand, and why it's so important to have the collaboration of the client. Okay, so the hypothesis is that energy carries information, and the cell processes this information no matter whether these are positive or negative impulses. The biological energy of the human being is the carrier or the medium to transport the life information in the whole spirit, soul, and body. And if there's a normal, harmonious flow of information in regards to energy, then the consequence is a normal, harmonious cell function. And here's just a picture of this dynamic swing between the information and then the dynamic between the transformative energy and the materialization and the utilization of information. And then we just think that as information never flows one way and the law of polarity is always active, there is an energetically coupled rhythm between energy and information and the cell, and vice versa. And hence, there's a biodirectional communication between the mind, the body, and the brain. So here now is a picture of what happens when you get an alteration of the vibration or an alteration of the material. So the coupling rhythm loses its coherence. So if information changes and abandons the pulsating, balanced rhythm, that's when you get a change in the function of the cells. And as polarity must always be maintained, cellular changes can't occur without consequences for the content of the information in the bioenergetic system. And I thought I would just add this in. So when that change happens, it starts to leave in the Kirlian, we start to see different patterns of phenomena in the photo. And those different patterns of phenomena tell us what stage we're in relation to a progression towards disease, or what we would call loss of energetic coherence. So the first phase is the energetic information stage. And at this stage, we're in a dysregulation of the hormonal, endocrine, psyche loop. So we've got three pictures showing the thyroid gland. So the first picture on the bottom left shows what the endocrine pattern would look like. And then there's a theoretical progression from a dysregulation of the hormones into the developing stage. At this point, we have toxic, inflammatory, or infective processes. And then if that inflammation doesn't get regulated, we start to get cellular changes, degenerative, what we call the degenerative phenomena, hyperacidity, deoxygenation, and the person starts to develop symptoms. And I think even if you don't know anything, you can see that that picture on the bottom right looks more aggressive, and symptomatic. You can see that removed point down the bottom. So that's in the uterus prostate area. So not a good sign. If you start to get those removed points, you know the phenomena is starting to become more materialized in the body. So a key aspect then of the therapeutic approach is that we always work via the regulation of the energy pattern to address the symptom complex. So the energy, in a sense, is between information and matter. So we're going to look at that, this process in the cases we're going to work with. And I just wanted to say this is very similar to traditional approaches of Chinese and Ayurvedic medicine. And in those systems, we think about it as treating the root to clear the reactions in the stem. So, for example, we have a saying, we say, if the soil is weak, the plants will be weak. So we want to treat the soil, the ground of information, and we're always trying to reconnect to that ground of information. Okay, so then that makes us wonder what blocks information from the esogetic point of view. What are the key predictors of a disruption in information flow? So the first thing is trauma, stress, and core conflicts that become encoded in the subcortical centers in the brain, the limbic brain, and specifically the implicit memory centers of the amygdala, the hippocampus, and then in the stem brain connected with all the survival drives. So when someone is in these repetition loops in these lower cortical centers, the person lives in a continuous state of perceived threat that conditions the person through neural clusters that are behavioral, emotional, perceptual, and somatic. And the consequences of these then play out in the autonomic and the ventral vagal system. So the person lives in a high state of sympathetic fear, flight or fight, or in a collapsed parasympathetic freeze. And actually, when you have very traumatized people, often they have a cluster of sympathetic and parasympathetic. So one part's in flight and the other part of the system has the brake on. So these are much more complex patterns that start to develop. And from Peter Mandel's perspective, eventually the physiological consequences of these chronic autonomic dysregulations eventually leads to a weakening in the immune system. So the other key aspect is the physical focal intoxications. And we know that in our world, we're under an onslaught of these focal intoxications. So we describe a focal intoxication as a focus. So it's a point of concentration in the body that's being affected by a toxicosis. So a poisoning of the body from a central place. So the starting point could be a tooth, for example, mercury in the teeth, very common issue, or the sinus cavities, the tonsils, or as we repeatedly see in the energy emission analysis, actually the entire drainage of the cranial lymph. And, often the glymphatic system, the head glymphatic system shows up. But Peter has a very interesting view about focal intoxications. So in his actually probably more like 50 years of research by now, Peter feels that all focal intoxications are actually a secondary phenomena. So there's always a preceding primary stress that then engages the focus. Exceptions might be things like mechanical injuries, such as surgeries or accidents. However, he still feels that the continuation and the acceptance of the focal information by organs and systems requires that the body already has underlying weaknesses. And this will be interesting when we look at the vaccine case, because you can see clearly in the before photos, the poor little child shouldn't have been given a vaccine. She wasn't really well enough for her body to take the vaccine. So from Peter's view, in stress situations, the function of the HPA axis is weakened. And then in the permanent presence of cortisol and norepinephrine in the blood, destabilizes the immune system. And then there's an increased susceptibility of organs and systems to external attacks. And this then can lead to the flare-ups of the focal intoxications. Because he points out that some people actually have a whole mouthful of amalgams and they never react to them. So he says there's this co-creation between the stress factors and the core conflicts and the physical focal intoxications.
Mm-hmm, mm-hmm. That makes a lot of sense, because we think about those people who, they have all these stressors in their system, and they lead a healthy life, while another person has them and they're led to chronic illness. So that I see that, and that's a beautiful explanation and understanding. And I just love this approach and this the information that you all are bringing through. And we have other people talking on the summit around the biofield, or when there can be these energetic disturbances in the field, and how that can instruct and inform our physical body. And I think you guys do an excellent job explaining why that is and how that comes to be in the physical body. So this was really insightful of this piece. I see focal intoxications all the time, and I do ponder, like, why are some of people like fine with these things and others not? So that makes a lot of sense, Rosemary.
Yeah.
So, you did an awesome job giving the general concepts, and I know Peter is as well. And in this next kind of part of our presentation, what are some of the key evaluation methods in esogetic therapies?
Great. Thanks, Christine. So the first thing we want to point out is that a central thought in our esogetic approach to making an evaluation of a client is that you shouldn't make an assessment based on one method. If we use several methods, we can get a deeper reflection of the patterns at play in a person's issues. So on the left side of the page here, we have a couple of the different options we have for making an evaluation. The central circle is the EEA, the energy emission analysis, and I'll show you that in a moment. And then we have other things like the iris diagnosis, finger testing, foot testing on certain specific points, facial physiognomy, tongue diagnosis, and segment analysis. And then, of course, the differentiation of the symptoms into the 4+1 disease principle. So categorization into fire, earth, air, and water categories. So the reason why we do this is because then sometimes you see something in the energetic passion, and then you can correlate it and track it through other systems. And when you get that sign showing up in several systems, then you know it's a much more significant aspect of dysregulation. Great. So the first and central part of the work is this energy emission analysis device. And this picture on the left is our new digital Kirlian device. And what this device can do is make current energetic processes visible. So these are the energies that represent the all-inclusive information about cellular energies and what we call the cellular memory. And over time, when you track the photos and you see these cellular energies over time, we can start to see which patterns are more fast moving. You know, maybe, for example, you just ate something you were slightly allergic to at lunch, as opposed to the patterns which might represent the core energetic issues that are causing the therapy resistance. So it's quite interesting sometimes to lay out quite a few images and start to look where the core patterns are. They start to really show up as much more repetitive. And again, we'll see some of these in the cases. So what is this energy emission analysis? It's a form of high voltage photography. And what we do is we make a photographic print of an electrically conducive object, which is actually a person. But, you know, we could also take a photograph even of an apple and see the corona discharge. So we use as a light source the luminous corona discharge, which appears around such subjects in a high voltage, high frequency electrical field. And so on the next page, I'm going to tell you what this allows us to see. So through the EEA image, the individual information pattern is made visible, and everybody's information pattern is entirely unique. And we say that the energy or psyche, as the transporter of the individual information, spirit, leaves visible tracks within the defined organ sectors, the matter. So through the Kirlian, we can see these three levels of information and we can see the dynamic between them. So what this allows us to do is to trace the causal chain of the disease backwards, independent of where it's located in the body or what disease label it carries. So we're going by the pattern recognition, not via the symptom description. Mm-hmm. So then this allows us to use therapies which are oriented according to the strategy of the energetic development of the disorder, and not, and again, we're trying to get away from chasing symptoms. So we're not doing the therapy according to the primary complaints or the disease title. So I just wanted to then make a point here, though, about these energetic images, is that, so we're looking at the relationship between the complementary medicine and the traditional medicine, or the allopathic medicine, the clinical diagnostic evaluations that we make, like blood work, for example. So we call the clinical diagnostic evaluations the explicit evaluation, and what we're seeing via the energetic pattern is what we call the implicit information. And just so people understand that in this system, we're really looking at a kind of a dialectic between the implicit and the explicit evaluation techniques to get a fuller picture and to get a holistic evaluation. And so a couple of other things that we use then, again, to get this more nuanced view. One is we use iris diagnosis to track the the genetic patterns that are laid down from the parental and the ancestral imprints. And you'll see in this first case that I'm going to talk about, there, in that case, there's a very interesting correlation between the EEA patterns and then the signs that are showing in the iris. And the combination of the two signs then really helps with the direction that the therapy takes. And then just other evaluation methods that also give us interesting information from the implicit perspective. On the left side, we see the facial physiognomy. And Peter says that the facial physiognomy can start to change up to 6 months before signs become physically manifest in the body. So say, for example, there are some very interesting signs that you can see, long creases in front of the ears. You can see them there on the left side in front of the ear. There are these kind of longer lines. And when you see these long creases, they indicate that the reservoir of power in the body is very, very depleted. So sometimes if you see those signs in correlation with certain of the EEA patterns, it tells you there's going to be a more therapy resistant case, because there isn't much energy left in the matter of the body to build recovery. And similarly, the tongue, I love using the tongue because the tongue gives you an incredible snapshot of the congenital and long-term changes in the digestive organs and also the heart, but predominantly gives you this really great snapshot of the digestive organs. And as I said, you can see long-term tendencies, and also, for example, through things like the coding, you can see the 24-hour changes. And I just find it very helpful if I can get a photograph of someone's tongue, I can start to get oriented. So tongue also very helpful.
Mm-hmm. It's just amazing how many patterns and how many clues there are in the body, and tongue and facial diagnostics are, just fascinating to me.
Yeah, I really like this saying where we say that every disease leaves a mark on the skin. Mm-hmm. And I think the body is incredibly accurate in the way it reports. Mm-hmm. So it doesn't just put a little pimple here because it couldn't figure out where to put it. It's very specific. So it gives me a great love for my body because of its incredible design and accuracy.
Mm-hmm. And ability to communicate. Absolutely.
Yeah.
It's like we're detectives, right? We're always trying to help us to get to the root cause. And you said some very profound things in this assessment piece. And, really, what I'm hearing and what I know this work does is it's not getting lost in the symptoms, right? When people have these multi-systemic, complex chronic illnesses, but there's a elegance to the approach to look at where is the energetic disturbance or where is the root cause from that level, and treating that first and seeing what unfolds. And so I know you're going to walk us through some cases to illustrate this approach. So we'll just dive into case one.
Yeah. So I picked this case, as I mentioned to you, Christine, before we got started. Mm-hmm. So I could see from the case history how I could have gotten pulled by some of the symptoms. Mm-hmm. And I found this case very interesting at how he works kind of higher up the food chain in terms of the hierarchy of the systems and to free some of these symptom patterns. So I thought it was a really good example of what we've been talking about.
Mhm.
So predominantly this is a pain case, and the patient he's a male and he was born in 1975. And so his presenting symptoms are lower back pain upon waking that radiates towards the abdomen. He was also getting dizzy with sudden stabbing pain in the head. He was having repeated diarrhea, but he wasn't tracking it, that it was related to food. He has insomnia. He was chronically tired. He was highly stressed, and he was a workaholic. In his history, he'd had measles and chickenpox, some surgeries, inguinal hernia, ligament and meniscus on the left and right ankles. And he'd had a significant trauma as a child. He was mauled by a dog, and he reported that he was still dreaming about this and had quite some significant PTSD. Okay, so then we start off and we take a look at the Curlian. And it's interesting when you go to see Peter, who's the master, he often doesn't look at the symptoms. He looks at the Curlian first because he doesn't want to get conditioned too much by the symptoms. So I've numbered the signs on the photos so you can follow it, because I'm aware that people don't know Curlian reading, but I think the signs are pretty clear. So just a little quick explanation. This is a picture of the 10 fingers and the 10 toes. And so we're looking at number 1, the index finger. So the index finger, up there at the top of the index finger, we have the spine on the medial sides of the fingers and the colon on the exterior sides. I'm sorry, the spine's on the lateral side and the colon's on the medial side. So the top there where we've got the 1, this is the medulla, the thalamus, and the pineal areas are indicated there. And I think you can see those little kind of dots at the top of the finger.
Mm-hmm.
And we'll flip to the next page in a minute and you'll see it on bigger screen. Number 2, again, on the left side, the middle finger, this is the limbic brain. And so this is also, it's also connected with the eyes. So we're starting to see there's quite a bit of stress in the control organs in the head. Finger number 3, which is also showing up on both sides, again, yes, you can see that little dot. That's the pituitary hypothalamic axis. So we know there's a stress pattern. And then we've got a very interesting signs on the medial sides of the 2 little fingers where we've got the 4. And these show heart strain and inadequate communication between the cardiac brain and the cranial brain, because the little fingers on the physical level are heart and small intestine. But psychospiritually, these signs also indicate that the person isn't connecting, because the small intestine is the enteric brain, the gut brain. We feel that these signs also indicate that the person is ignoring his own impulses and internal images. So you'll see from our point of view, this is actually something that's causing deep stress in his system. He has what we call an outwardly directed psyche. So also you can see in this photo that the feet are quite weak. And the feet are connected with theta and delta brain waves. And so they're an indicator that he's not sleeping well. And the feet are also connected with all the digestive organs. So we can also see there's kind of weak gut, weak immunity. So that's the overall impression. Stress on the cerebral sectors, stress in the gut, and these kind of deep kind of stress and splitting off from his own flow of information. So that's a larger picture. So I think it makes it clearer. Then if you look at the top of the fingers, you can see the clear stress. And especially that there's a slight compression in the fingers. So then it's like that feeling when you have a headache. You've got this kind of head pressure.
Fascinating.
Okay, so now we take a look at the iris. So overall, this is what we call a lymphatic central heterochromia eye. And what that means is you can see that kind of yellow star pattern around the pupil. So this is not specifically relevant for this particular case. The thing that Peter's very interested in this particular case, and I think it's very obvious, is that the right pupil is larger than the left. And the right is also vertically oval. And what this indicates is a danger of cerebral failures. And we know that we've seen from the Kirlian this stress in the coordination organs of the head, specifically the medulla, thalamus, pineal, limbic brain, HPA axis. Another sign is that the left pupil is also slanted left ways. So you can see they're very misshapen. And according to Joseph Angara, who is one of Peter's main teachers, a great naturopath, this indicates that there's a predisposition towards a sideways paralysis. So there's a possibility for strokes. And Peter commented about this case that he was noticing these signs very strongly because this guy wasn't that old. And so he was concerned that the signs were so extreme. And we won't go into it, but there are also so we're looking at the pupils, but he's also pointing out that in the iris of the eyes, there were other corroborating genetic predispositions that concurred with these pupil deformation. And while the iris of the eye shows the genetic signs, the pupil mirrors the present situation of the client. So we need to note this in relation to the complaints. So we're starting to see through the symptom complaints, the Kirlian and the iris, a tendency. And there's a little quote down here that strain of the cervical spine can trigger pupil deformations. So you'll see this will come up again later. So the first thing that Peter does is an interesting move. He doesn't treat the symptoms. He uses this treatment, and again, it's not within the scope here to go into how to actually do the treatment, but I just wanted to show pictures. So this treatment is an expanded treatment of the pineal. And the pineal, in the way that Peter views it and view research of Professor Penrose and other researchers, the pineal is one of the portals to the 0 point field. So what Peter basically does is reconnect the system to the 0 point field and to, reestablish this coherent light flow. So we use this kind of treatment for systemic, degenerative, and chronic diseases. So, for example, people who are psychologically paralyzed, and this guy has quite some stress aspects, diseases that take place in the brain like apoplexy, which have a poor treatment response. So what he does first is, and this is a very classical way you treat, is we just do a treatment to open the field and the flow and to increase the reaction capacity of the client.
Mm.
And also then at home, he is given, so you can go to the next page, he's given homework to do daily. And so these are, he rubs these points with the energy activator stick to de-stress the hypothalamus, to release spasms and pain, and to release emotional tension. So we're working on the hypothalamus and the limbic brain. So point number 3 and 4 are for the hypothalamus. Point number 2 is for the limbic brain. And point number 1 is just a pain point. And so we're relaxing the head, the abdomen, and the pelvis. And this is a quick little treatment that you can do daily for pain relief. And I just thought I'd show on the next page the device that we use to do this. So here's the crystal energy activator stick. So you can see it's a wooden stick. These are like $15, so you can give it to the client. It has a little round end on the end. So first you rub with the round end, and you do it in a kind of a circle motion. As you can see in that photo, it's got those little arrows. And then you turn it around, and that's a small Swarovski crystal. And you put the crystal on the point. And it's a surprisingly powerful, it's like a little mini light therapy treatment.
Mm-hmm. That's so fun that the patient can do that at home, right? And feel empowered. And then also, just a cumulative experience of doing that probably shifts people that are, doing this at home. So
yeah, to keep the treatment effect happening, we've done the very strong treatment. That treatment, the pineal treatment, we actually using the gray rods for therapy resistance. So we give a very strong push, and then we get them to keep moving the energy pattern.
So cool.
Okay, so he comes back. Oh, this is the control picture after the session. So we always do a before and an after photo. So you can see, okay, how did it regulate? And as you can see, there's even, I think, again, even if you don't know anything about Kirlian, you can see there's a balancing between top, bottom, and there's increased energy flow in all the areas. The head strain continues. So 2 and actually on 2 and actually left and right, you can still see, even on the right index, you can see a little flattening on the top. So it continues, but it's improved. The little fingers, that heart strain on the medial sides releases, but it's like we peel back a layer. And then if we look at those vertical axis on the left and right ring fingers, so these 2 fingers, we can see this is the diagonal axis between the HPA axis and the genital region. And that axis is a very significant stress axis. And again, it indicates that this person, especially on the left side, in their early childhood, there was poor attachment. And so again, they start splitting off their inner impulses because they're looking outwards to get the attachment. And this can be the start of someone who kind of has a compulsion to prove themselves and can wind up in burnout states because they're constantly trying, because we're saying then at age 3, they didn't get to stay just relaxed in their own information flow, which you get when you have parents who are there holding you. So there was some weakness in the holding environment here. And because it's on the left hand, which is causative, and the right hand, which is what's up right now, he hasn't resolved this pattern. So that's kind of some of the psychological background. So then here's just a bigger picture of that control photo. And then he comes back a week later. So we can see that the person overall, you can see that those hood formations on the top of the fingers have cleared. So all the top of the index fingers here, there's not these splitting off of the radiation in these toxic blobs. So it's more balanced. So the client reported that their back pain and their sleep improved and the head pressure improved. He had more diarrhea on the day of the last session, and then it started to resolve. Then we have a look at his eyes. So they've somewhat normalized. And we can see then that the decompensation in the brain is starting to resolve. So he had no more complaints for 6 weeks. But this is something that I'm sure you are very familiar with. He got back in the pattern. And so again, this is where the deeper tendencies in the psyche keep taking the person back into the behavioral patterns that re-engage the symptom picture. So he couldn't hold the correction. So he comes back and he's reporting that the back and head pressure are increasing, and he's back into intense life stress. So we can see that the ring and the middle fingers show the stress on the HPA axis, and the middle finger is the whole head, the eyes, the liver meridian, and the limbic brain. So it's also showing there's a bit of emotional stress. And the feet have become very empty. So we know that the brain rhythms are off and the person's getting, especially theta and delta brainwaves are off, and the person's getting into insomnia. And then that sign number 2 is a very interesting, this is what we call a conflict sign. So this is some core conflict that hangs up the immune system and starts to weaken the body and weaken the immune system. So we look around the photo to see where's the axis. And what we can see is that on the left and right ring, little fingers, the ring finger vertical axis is also still showing, but we're showing another axis, which is this cramp axis on the 2 little fingers. So you can see the lines there for those diagonal axes. So on the physical level, this is a diagonal axis between the heart and the small intestine, the duodenum and the jejunum. And we know he has chronic diarrhea. So we know he has issues with the small intestine. So this heart small intestine axis. But it also indicates a kind of heartlessness of the parents. And the left little finger is about the birth, and the right is the personality in the now. So
Yeah.
again, it's this same tendency to create stress and conflict in the system. And we're saying it's encoded in the somatic brain from when he was very small. It could have
Mhm.
been that the entire atmosphere in the family was just a high stress family. We don't know what was going on. Think about children, little children now. They're in atmospheres where parents are under financial stress, and other deep stresses, and the children are in this somatic environment, even if they're not entirely understanding the content of what's going on. And this one, as it's on the left side, it's in the prenatal area. We say that the somatic brain is switched on from 6 weeks in utero. So imprints are even getting laid down and affecting the formation of the child's psyche from 6 weeks in utero.
Mhm.
So, how this shows up is, again, as I was mentioning before, the person has a kind of a somatic potential to engage in stress, and he doesn't trust his own instincts, and he tends to conform to other people's opinions. So this
Mhm.
is leads people into overcompensating and overperforming. So this is kind of a background sign, what we would call a background issue.
Mhm.
So what I'm trying to show is this dynamic between the mind and the body here.
Mhm. It's beautiful.
So again, Peter does a treatment where he works the higher control centers in the brain. And I want to just explain something. We see the brain as the switchboard between information and the body. So he does two things in this treatment. It's called the 8 on the forehead treatment, and we're regulating the medulla and the pineal. So the first thing we're doing is we're regulating the lower cortical centers, and we're freeing up this stress in the psyche by releasing the stem brain, the drives. And by
Mhm.
doing that, we're facilitating the circulation of information between the spine and the brain for regulation of the heart, the upper stomach, movement intentions, peripheral circulation, and balance. So it should work on the symptoms, this, but it also
Mhm.
should free up these deep stress patterns that are affecting the heart.
Mhm.
And then again, we're opening the pineal, which we see as the control center of the brain. And according to Penrose, connects via the structural cavities of the midbrain to the 0 point quantum field. So again, Peter just tries to open the cellular coherence by opening the field, the connection to the field.
Mhm. So cool.
So here's the control photo. Again, it works very nicely. Peter can quite easily get the stress out of the thalamus, the pineal, the top of the index fingers. And then the other thing is the left-right imbalance between the left and right hands is resolved. And that left-right imbalance is very, very interesting because it's an indicator for physical or emotional shocks under the age of 25. And
Mhm.
what happens during this treatment is a fascinating thing that I often see happen with these esogetic therapies is that the client suddenly recalled a serious whiplash injury at age 9. So we get the brain back on track. So he had not reported this initially, but we get the brain sequencing better between the information field and the body, and the memory comes in.
Mhm.
And that memory is very much connected with the iris pattern that initially shows up.
Mhm.
Another important thing, though, in this photo is that that conflict sign is still there.
Mhm.
So we know that even though we've moved the energetic pattern, the dynamic of the blocking of between information and the body is still caught up in these core conflicts, these axes. So they give the client, this time they give him conflict therapies for homework.
Mhm.
So we can use brainwave devices, we can use sound therapies, we can give other patterns using the energy activator stick. So they're going to try to get him to get this open. So you see, there's an interesting thing that's happening is the dynamic between the psyche and the body is starting to expose itself. So we want to start to really free up that frozen pattern in the psyche. Because then if the psyche can calm down, the symptoms, the energy can start to flow, the cellular coherence can start to reestablish itself, and the symptom pattern should resolve. And I thought I'd just throw this in because I think it just to elaborate a little bit. So I'm sure many of the people who are listening, and I'm sure you, Christine, know that previously neuroscientists thought that when something was encoded into long-term memory, so these patterns say in this manner, H3 and birth, very strongly, it became a permanent feature.
Mhm.
But since the late 1990s, all this exciting new understandings have come up regarding neuroplasticity and memory reconsolidation. So what we understand now that all the somatic neuroscience has come into the vernacular, is that traumatized people live in a feeling of knowing what will happen. The body is catalyzed into a state and it's in a loop in this state. So the subcortical structures are constantly being cued by expectation, and through repetition and learning, this lays down a categorization in the procedural memory.
Mhm.
And then this sets up what we call a confirmation bias. And we call this a loop. The person's looping in a certain pattern. To become flexible and to open new information, they've discovered that we need a pairing of the emotional memory with discrepant information. So, for example, I know that you use tapping. Tapping could be described as a way of introducing discrepant information.
Mhm.
In this system, we use these therapeutic light patterns, like that figure of 8, brainwave systems, sound therapies. We use these to open the possibility for memory reconsolidation to occur. So, for memory reconsolidation to happen, we need the limbic system engaged. And the person, in a sense, needs to be in the state. So, in a sense, we need to open up the trauma a little bit. We need to get the brain engaged. We can't, this is why talk therapy doesn't work, because you can't talk about the issue. It won't release the somatic patterning of behavior, emotions, perceptions in the midbrain. This is not language based, the stem brain and the midbrain. It's pattern based. So Also, for the new memory to form, then we need the ventrolateral right prefrontal cortex and the hippocampus, midbrain, long-term memory storage to be active. So this is what he's doing with these treatments. He's opening up these centers. What this does is it allows the old pattern to unlock and for memory reconsolidation to happen. So you literally set off another pattern, which in trauma work you call moving out of the trauma vortex into the healing vortex. And then you start laying down new neural nets, new associations. So the implicit can become explicit and new information can be received. The brain neurons refire and support a new integration. When we're in integration, the neocortex, the upper centers, are soothing the lower centers in the brain, and the person can be released from these triggered automatic responses. So what we're seeing with this guy is he's constantly kind of, in a way, building stress, probably not even consciously, and engaging in a lifestyle that after 6 weeks, he builds up the pattern again. So when the upper cortical centers are engaged, then your meta awareness engages and you can have insight into your own narrative. So you can, Peter describes this as grasping your own information. So I wanted to mention this because I loved it that he remembered the whiplash. So we got the somatic brain moving, it came back on board. I've seen this working with vets who've had serious head injuries. They'll suddenly tell you a whole lot of things they've never told you before. And you're like, oh, that's nice. We're getting a little kind of reconnection. So Stephen Levine says, we make a memory alive in order to update an old memory based on new information. So I just wanted to have that little kind of interlude here because I think it's great for the understanding of what they're doing with these treatments.
Yeah, no, that's great insight and great explanation and what you can see unfold when you work with a patient in this way. And I love Stephen Levine's work, so that's great.
So after he looked at the control picture, then he goes to the next slide, and he looks at the two iris pictures. And he says, we can see some balancing. It's getting better. But he also decides that he's going to refer the client to a neurologist for an MRI because now this whiplash injury has come to light. We know obviously there was severe unprocessed shock pattern in the system and probably not fully titrated out of the body. So truncated release of trauma. And the neurologist confirmed that there's upper left cervical spine is strained and displaced. So Peter recommends for this client ongoing osteopathic care with the energetic therapies.
Beautiful.
Yeah.
That's amazing.
Yeah, so it's very interesting, this correlation between the signs in the eyes and the signs in the Curlian, and then what gets activated through the treatments.
All right, Rosemary, thank you so much for presenting the first case. And now you have another case for us to kind of share really the disruptions in energy balance in a child, I believe this case is going to show. So I'm really looking forward to seeing what you guys uncovered.
Great. Thanks, Christine. So I wanted to share this case because we're going to go in from the focal intoxication side. So in the other case, really, in a sense, we could say the cause was several layers of unprocessed trauma. And we were just watching the dynamic in the EEA between the psyche and the impact on the brain and the energetic patterns. And in that case, the first step was then to regulate the overall energy pattern. And then gradually, through a process of elimination, we zoom in and we find the key place in the images where the stressor is. And as I was mentioning, then we try to create some way to create a memory reconsolidation to release that trauma.
Mhm.
So in this case, though, the key issue is the focal intoxication. This is the cause. And I just want to mention here that my colleague, Inge Cox, who's one of the European trainers from Belgium, she actually created this study, and we'll have a link for the whole study in the links. And so she has 4 or 5 different cases. So just as an example of a focal intoxication, I thought I'd show one case.
Perfect.
So as we're saying, in this case, the causative factor is the vaccine, which acts as the focal intoxication. And through the images, we can trace the energetic impact and then the consequential reaction in the body. So again, just to mention that from the esogetic perspective, the reaction is connected to the information in the body, to the energetic patterns in the body, and where we encounter the disturbances after the vaccine gives us information about the background psyche and the physical weaknesses of the person. So what this means is, depending on the state the person is in when they get the vaccine, according to Peter, will further worsen those tendencies.
Mhm.
It'll accentuate those tendencies. And when we're looking at the trauma process in the images, we track from the left little finger birth across birth, age 3, age 6, age 9 to age 12 to the thumbs.
Mm.
And we say the thumbs carry the burden. So the attachment process plays out across from the one little finger to the other little finger, from the
Mhm.
birth to the personality. But when we're tracking the focal intoxications, we start from the thumbs. The
Mhm.
thumbs are the center of the focal reactions. They are reporting, in a sense, there's reactions further back in the fingers. So what we do then is we track back from the thumbs and look around all these different focal centers, like chest, breast area, the appendix, the colon, and various other centers. And we see how deep the focus is, kind of how systemic it is in the body.
Mhm.
So we're going to be focusing in this particular case on the reactions in the thumbs as the center of the focal reactions in the body, and we call it the lymph reactional area. So especially the
Mhm.
lymph, the head lymph is a very important indicator for focal stresses.
Yeah, I see that a lot, Rosemary, in my patients. I feel like, through my assessment tool, there's a lot of blocked lymphatic drainage in the brain and the cranium. So this is another perspective for another common theme we see in our patients.
Yeah, that's what's interesting, is having this dialogue with different therapists, because you see the common themes.
Mm-hmm. Mm-hmm.
So the thumbs then also are an indicator for the weakness of the immunity connected with these deeper issues. So
Mm-hmm.
they're kind of like a red flag sign.
Mm-hmm.
Okay, so we're looking at this little girl, and she's 5 years old. And this picture is before the vaccine. She's going to
Mm,
get vaccinated for diphtheria, pertussis, tetanus, and polio. And so the first thing we look at is sort of from the 10 feet away view. So we can see that she has a left-right brain imbalance. So we know that when it's a right laterality like this, where the right side is weaker, some physical shocks under age 25. And this hemispheric specialization is actually a really important thing to address because it blocks information from running through the body in a coherent way. So it's kind of a primary disruptor. She also has a top bottom balance. So we know there's stress on the diaphragmatic arch. And I'll talk a little bit more about this. So the two primary orienters are off. Then when we zoom in a little bit closer, you can see via these green lines that there's a weakness in the base. There's a lack of radiation in the base of all of the fingers. So this actually connects to the weakness in the feet. It means there's a weak root psychoimmunity, but it's also an hormonal endocrine sign. And then as a result of that weakness in terms of the circulation of energy, then you get this blockage in the head lymph, which you're noticing. So often it's connected then with a very weak lower body energetically. Both thumbs show poor immunity, and we see a dynamic between immunity and attachment. So we say when there's poor attachment, the child's either getting abused or neglected, it will have a weakening effect on the immunity. So she has some stressors too. And then this lack of information flow between the gut brain and the main brain. So all the serotonin, dopamine, all the opiates that we should be getting through a strong enteric brain are not online. And also, just in a basic way, she's not connected with her own innate source of information. So, okay, so then let's have a look at the photo after she gets the vaccine. So, overall, and we're going to zoom in on these fingers in a minute. Overall, the photo shows a toxic reaction. And if you look in that middle finger of the left hand on the upper area, you can see it's very blackened there. So there's a lot of, and that's the toxic limbic lymph finger. There's a lot of blockage into the picture. And then the interesting thing is you might think, oh, this is better because all the lower sides of the pictures of the fingers have filled in. But what it means is that the system's moved into a reactive process. There's a stressor come into the system. And the reaction is actually evident all the way across from the left little finger through the left ring finger, the left middle finger, the index, and both thumbs. And then the feet become much weaker. So all those patterns of the issues with the psychoimmunity, the gut, and the sleep rhythm disturbances become more pronounced. Her whole system gets strongly weakened. And just a little note here that the right foot is connected with, the left foot, is connected with delta waves and deep dreamless sleep for cellular regeneration. And the right foot is for theta waves, dream sleep, brain regeneration, and processing of emotions. So all of that also becomes more under stress. Okay, so now what we're going to do is just go through the fingers one by one and kind of track all the reactions that we see. So you see, we go from looking at the wider pattern, and then we zoom in on the fingers, and we zoom in on all the specific phenomena to get the details. So just for everybody, the white square is actually the picture of the finger and everything that we can see on the left little finger. So you can see we've got, you see that's an aggressive zone, the ileocecal valve. Then we've got the heart and the small intestine and the breast, chest area, lung, bronchial, and a lymph congestion zone. So this is what we call the second lymph band. So when we look at the signs here, we can see that the blood pressure reacts. So there are two purple arrows up the top. Those are what we call toxic signs, these little sort of grape-like signs, indication for inflammation or infection. And then down in the bottom, the lymph, breast, chest area, there are also these small removed points. And you can see that kind of granulation on the inner rim. So there's quite some reaction. And then the other thing is just looking at the overall radiation. It's a very high sympathetic stress radiation. Okay, so then we look at the ring finger. So as you can see in the white square, the ring finger is the hormonal endocrine finger. This is the left ring finger. So we can see up the top, the pituitary hypothalamic axis, parathyroid, thyroid, thymus, pancreas, adrenals, ovaries, testes. And the medial side, when you have weakenings on the medial side, it says there's strong psychological shocks. So with this girl, there are toxic inflammatory reactions in the HPA axis. So that vertical line shows the top, the thymus, the pancreas, the adrenals, and the ovaries. So everything's getting hit. There's a full-scale inflammatory reaction. Then we go to the index finger, which is the spine and the colon on the physical level, because we can see physical, psychological, and what we call symbolic signs on each finger, but we're looking specifically physically in this case. So at the top, we can see there's pressure on the medulla, the brainstem, the spinal cord, and that means there's pressure on the entire nervous system. And then specifically the neck and the thoracic areas react. See the photo, the arrow on the left. So there's, you know, as we know, this huge lymph drainage pathways in the neck. And then also down the bottom, which is a more subtle sign, so down the bottom right of the picture, which is the colon area, yeah, you can see that the corona starts to break. So there's a reaction in the sigmoid colon and the rectum. And that's significant because, as you can see, that's what we call an aggressive area. That's a focal area. So that area is reacting. It's indicating to us there's a focal reaction in the body.
Fascinating.
Yeah, it's quite detailed. But then here again, let's just look at the little white boxes. So as you can see, the thumbs, we've got the sinuses, a great focal indicator. We've got the retromolar area. And then we've got all the teeth, also strong carriers of focal intoxications, dynamic between the teeth and the different organs. So that feedback relay. and then frontal paranasal sinuses, and lower jaw lymphatic tonsillar ring.
Mm-hmm.
So, as I was mentioning, carrying the burden of all the focuses, which is why the head lymph reacts. So, we're seeing here, take a look at that left thumb on the left picture.
This one.
Yeah. So you can see all these toxic phenomena there. So the head lymph strongly reacting. Actually, so the thumb is going up that way. So the top left side of the picture is the whole frontal sinuses are reacting. And then the bottom part is the small intestine area. And then on the right thumb across the middle there, that's the lung colon. And colon is also connected with immunity.
Mm-hmm.
So overall, the toxins are released from the frontal nasal cavities, the throat, the jaw, and the neck.
Mm-hmm.
And then it transfers over to the right. So we say left hand is causal, right side is what's up right now. So it's in the body, it's happening right now.
Mm-hmm.
So then what we do, so you see, we look at the overall pattern, and then we zoom in, and then we look at actually the relationship between the parts. And that tells another story for us. So it's just an infinite way, if you have enough skill, that you can read the patterns. So what this patterning shows is the three key lymphatic areas that react. So first is the breast lymph. So the whole chest lymph react, and the whole axillary lymph. Then in the index finger, the lower part of the colon, the lower part of the spine, we can see the reaction in the abdominal lymph, and then via the thumb, the lymph in the throat. So quite a strong impact. And so overall, this gives us a picture of how the reaction moves from the left little finger to the thumbs. And then visually, we can see how the reaction unfolds in the entire lymph system after the vaccination.
And that makes so much sense, knowing how vaccines affect the body, the lymphatic stress. I mean, everyone's individual, but, I see the lymphatic system as really a huge area that's overlooked, that can be really rewarding to treat. So that's so fascinating that the Carillion shows this.
Here, then, we're just showing, and I'm sure you understand these pathways very well, but a kind of a image of the pathways for stress stimulus in the body via the vaccines. And then also for us, we understand that the EEA image corroborates the patterns energetically. So we see the vaccine as the stress stimulus, and we know the pituitary hypothalamic bundle reacts, but then also via the index finger, the sympathetic nervous system reacts. Then there's a dynamic between that and the adrenal medulla and the adrenal cortex. So this kind of mapping correlates with the energetic picture. Now we have the EEA image 2 weeks after the vaccination, and you'll see when you read the whole study that what it was using a lot in this particular treatment approach was she used homeopathic remedies. And you'll see in the study that actually then they had tried regulating the pattern using homeopathic remedies before the vaccine to see if they could mitigate the effect of the vaccine. So those are some other interesting cases to have a look at. But here they've been administering homeopathic remedies for 2 weeks. And so then when we look at the images, you can see that, especially on the left hand, the ring finger, hormonal endocrine, definitely the pattern is much better balanced. And then the thumbs are really looking much better. You can see that those focal blobs and those toxic signs have cleared. And also the feathering, the emission, showing the coherence in the dynamic between the information, the energy, and the cells, that cellular swing is working, then we get this nice balanced feathering radiation.
Mm-hmm.
And then in the feet, the radiations are starting to come back online,
Mm-hmm.
even though her psychoimmunity was already out. And so it needs more work, but it's improving. The place where a reaction is still showing is in the right ring finger. So this is what it's saying is that in terms of what's active and up in her body right now, her hormonal endocrine system is still needing more support. It hasn't fully re-regulated.
Mm-hmm.
So that's just one presentation of one case, but I think it's an interesting depiction of a focal stress.
Mm-hmm. Yeah, I'm just fascinated by this, and it's really wonderful to see the improvement pretty quickly, right? 2 weeks is not that much time.
Yeah.
So, all right, you have, I think, one more case for us.
Yeah. So again, the reason why I chose this case is because I thought it would highlight some other things. And in this case, there's an interesting dynamic between the psyche, the genetic pattern, and focal intoxications. He really has all three issues going on.
Mm-hmm.
So, really complex dynamic for this little child. And then I'm going to show you these ophthalmic genetic therapies that we can use. So he's a male child. He was born in 2011, and the pregnancy was normal, but the mother used antibiotics during the pregnancy.
Mm-hmm.
So a focal intoxication, you'll see that gets reinforced. He was born with a clear cyst on his penis, which cleared.
Mm-hmm.
But these are important in terms of when we look at the energetic pattern. He cried a lot as a baby, especially around 5 p.m., which kidney bladder time in terms of Chinese clock. He also was suffering, and he suffers from these night terrors, which at first they thought were kind of epileptic seizures. They looked like seizures because his body was stiffening and he was drooling. However, they did test for seizures, and via sleep studies, they couldn't find any results.
Mm-hmm.
Until age 3, he had 3 to 4 very severe ear infections, again, kidney bladder function circle, which were treated with antibiotics. Again, so these constant antibiotics. At age 3, he was diagnosed with sensory processing disorder and issues with fine motor skills. He licks his nose in a kind of a nervous tic, and he was also diagnosed with ADHD. He was cleared for autism, but he has language processing issues, so he has difficulty following long instructions and expressing himself. And he sometimes regresses into a kind of baby speak. And when they first brought him to me, he'd been causing a lot of issues in the classroom. He was tearing things up. He was crawling under the tables. He was shouting at the teacher. But the interesting thing was, after we did some basic shock treatments on him, he actually was able to communicate that he was being bullied.
Mm.
And it was happening when the teacher wasn't looking.
Mhm.
And he hadn't been able to communicate it to anybody. And so that was really important in terms of a turning point for him.
Mhm.
Okay, so let's have a look at the energetic pattern here. Oh, first of all, this is very important. We're going to
Mhm.
look at the parental history before we look at the pattern. So the father is Mexican, and he was from a lineage of a cartel family. And he saw extreme violence. He saw people being murdered. His mother actually couldn't leave his father because he would have killed her. I mean, it was extreme violence. So he escaped. He came as, under the border at 18 years of age. And he had many years where he was barely surviving. He developed alcoholism, which he still struggles with. He has severe PTSD, anxiety, insomnia, very severe jaw tension. And the pregnancy also was accidental. They were just dating and they accidentally got pregnant. And he rejected the child for the first 3 years, like fully would have nothing to do with the child.
Mhm.
But they've actually gradually come through as a family and they're starting to form a bond. The
Mhm.
mother also had her own abandonment history. Her mother left her at age 6 to go and live in Costa Rica. And so both of them, as you can see, very poor attachment. And then the father, addiction, trauma, and this extreme violence in that ancestral energy. So let's have a look at the way Peter then thinks about this from, in a sense, from the symbolic psychospiritual level. So Peter says that the Vesica Pisces is the symbol for the first division of the cell, which happens at conception. So we can see here in the picture, in the conceptualization, we have the two cells overlapping. And then those grid lines there on the picture are a symbolic representation of the interference patterns that happen at the subatomic level, which are evidence for the buildup of information in the system. So we say that when the two parents come together, there's a downloading of that information into the first hologram of the child and into those that developing information patterning that's happening in the child. So already there's an imprinting in these lower cortical structures via this information transfer of the patterns of the ancestors. And I showed these pictures to Marcus Wunderlich, Peter Mandel's son, and he said this child couldn't take the information, especially from the father's lineage. So he saw this fire looking at the Curlian. And then it actually was so severe that it creates a disruption in the very subtle information patterns, which we call the DNA.
Mhm.
So it has physical and psychological effects.
Mhm.
So, okay, unfortunately, this photo is a little bit dark, but I think we can still read it.
Mhm.
So, the first thing is, again, looking from the wider pattern. This time it's a left laterality, indicating emotional shocks under age 25. And as we know, the brain's not fully formed till age 25. So this is kind of the first laying down of the patterning in the subcortical centers, and very much conditioned by the positive affect with the parents and the whole family system. The other thing is that if you see where number 2 is, there are these cones, inward cones, in the phenomena there, and they indicate problems in the second and third trimesters. And they also indicate something. It's a way that Peter looks at it. He says this soul was going to draw an issue to them, regardless of what issue was going to come. This soul is kind of in a state of complexity. And so that soul then merges with that ancestral lineage and kind of magnetizes this particular conflict to resolve. And Peter says that this sort of epileptic kind of appearance that he has, this tendency, is connected with this birth shock, connected with the second and third trimesters, possibly connected with when the mother was taking the antibiotics. So that's kind of, maybe you don't necessarily have to believe it. You can just hear the thinking. Then as the information moves, because now we're looking at the information flow, the left ring finger, age 3, the stress is transferring. And you can see this strong vertical axis. You can see the hanging down on the bottom. So it's a sign of these deep father issues. And he says the child's really carrying a lot because it's a heavy burden to be rejected by your father. And then when we get to the middle finger, age 6, can you see how there's no phenomena on the medial side? So this is the limbic brain, age 6, and the patterning already laid down. There's a shock pattern. So then this is corroborated when we look at the feet, because the feet are the shadow of the hands. They again carry the burdens of the hands. The hands are primary. So the first thing is there's both little toes are missing. So on one level, this is connected with the kidneys. So we know he's having night terrors around 5 p.m., or he's having nightmares that are happening around 5 p.m. And then also he's bedwetting, kidney bladder signs. So on the physical level, this corroborates, but also on the left side, because it's under the prenatal toe, Peter says it's connected with prenatal issues. Then in terms of this mesenchymal toxicity in the feet, which is an indicator for the impact of the antibiotics, we have stress, especially on the 2 big toes, the pancreas and the liver. So where 5 is. And so this person is different than the first 2 cases where we had the weak feet. The feet are heavier. So when we say mesenchymal toxicity, we're talking about toxins that get dumped in the extracellular matrix. So, Kissinger and the whole thing of the ground substance. So we're saying that there's the body needs to be detoxified and cleared out. But what their viewpoint is that the stress in the conception actually it co-creates this difficulty for the body, for the lymph to release. Because we say all unconscious stress reactions hang up the lymphatic system. So Peter's point of view is, first of all, if we can relax the psyche, the system can flow, the
Mhm.
body can then turn over.
Mhm. Mhm.
So again, we try primarily to, as a primary step, to just reestablish the flow of information.
Mhm. I see that a lot. I feel like I'm always telling my patients like health is flow, and we have to figure out how to get often the extracellular matrix and the lymphatic system moving. So this is a wonderful other angle to look at what could be creating stagnation or congestion in those systems.
Yeah, well, there's definitely a dynamic between the hormonal endocrine system
Hmm.
and the kidneys and the liver. Yeah.
Yeah, yeah, definitely. Do you have anything else to say on this one,
Sure.
Mary? We're
Let's
good.
go forward. So, okay, so I'm going to show you for now the primary therapy that we use. So the first thing that we do. So I'm going to give you a bit of a background about these what we call ophthalmic genetic therapies.
Mm,
So epigenetic scientists discovered that experiences of individuals um, before procreation cause the DNA to adapt to traumatic stimulus in different ways. So this is in utero through the
mm,
whole conception and the birth experience. And this adaptive gene can be affected by wars, famines, and mass genocides. So, as I mentioned before, everything starts to get imprints start getting laid down in the lower cortical centers from 6 weeks in the womb. So
mhm,
all is, if you've got these strong stresses, they're already getting laid down.
mm,
So ancestral and generational trauma, generational transmission of energetic imprints, personality, behavioral traits, and spiritual beliefs can date back 6 generations. So that whole ancestral lineage starts to get embedded in
mhm,
this newly forming being. So, Peter has developed a series of therapies, and these are wonderful therapy because they're very quick to use. They take about 15 minutes, and they will always give a very powerful resetting of the system. So they're great opening treatments to do because at first, of course, you want to give the person some confidence that they can feel better because then they'll commit to the
mm,
therapy. You don't want to be going on and pushing on that background, father issue in the first session.
mhm, mhm,
So these can be used to work with the phenomenology of the ancestor fields because he says through these OGT therapies, we can touch on the place where these overriding patterns are stored. So,
mhm,
morphogenetic field level.
mhm,
So, first, we do this treatment. And again, I can't give all the description of how we do the treatment, but we do this OGT therapies.
mhm,
And we work on just the overall DNA pattern. And then what we do is we worked with a bunch of other therapies with him. One is basic prenatal therapies for the shock in the second and third trimesters. Another is these ancestral unhooking therapies, especially for the father's ancestral imprints. Peter says an interesting thing. He says when you have sick children, you should treat the parents. You also need
mhm,
to take a look at the parents.
mhm. Yeah, I think that's so wise. Mhm,
Yeah, because the father's actually, it's great. He's getting a lot of work done and he's really committed to his recovery. Mother
mhm,
father treatments, brain coordination therapy. So, basic brain coordination therapy because he has sensory processing
mhm,
issues. So, for example, we have some other great OGTs called the OGT of the senses, which is another one to get the brain syncing and in coordination with itself. And then, of course, we're trying to clear the antibiotic residues. So we do these mesenchyme rhythm therapies for working with the extracellular matrix, supporting the clearing of the extracellular matrix. And then something called the Vogler cross, which is working on the stomach and the pancreas. So also to get the transportation and transformation happening.
Mm-hmm.
Okay,
Wow.
so after a couple of months of therapy, you can see it's looking a lot better. He's overall, the overall reaction in the system has cleared. The feet, you can see the mesenchyme has really nicely cleared out. So we've kind of through this, creating this dynamic between the psyche and the body, working both sides and balancing the brain. The mesenchyme clears. The kidney toes are still a little bit offline, but at least on the right side, we're seeing some whites. So we're starting to get a proper formation. The thing that remains, and again, this is what's interesting as you track through, is these two internal cones. And actually, there's another way that you look at the photo. Yeah, the one and the one. This kind of bowing in. Can you see how the radiation isn't a nice round radiation? There's actually a square between the little toes and the two little fingers. And this is an indicator that there was a primary conflict at the time of the birth. Which we know there was, because it wasn't a conscious conception. And also the father really wasn't in a state where he could have a child. He was an active alcoholic. They weren't even in a committed relationship. So as things clear, we get down to that layer, then we might do a little work on that layer. Once you see we've gotten him much more balanced, then he can release that imprinting from that conception and gestation period.
Yeah, wow. Rosemary, this is beautiful. And you opened, I'm sure, so many people's minds to this beautiful work. And I'm just in awe, as we were just chatting prior to our conversation, of all of the, patterns in the way that the body communicates with us. And there's so many clues, right, to how to best support a patient. And this is just a, beautiful system of assessment, but also really elegant treatment, really, to allow the body to do the work to heal. So I just am so grateful for your beautiful lecture. And I'm sure a lot of people who can practice might want to learn more about studying with you, or how to learn more about this work. So here's the website. And can you just touch on a little bit about training and how that works?
Yeah, so if you go into my website, there are a lot of resources there. So a good place to look if you want to follow up with more information is the media part, where we have news, and I have a bunch of other podcasts in there if you want to, we didn't get to touch on colors and fun biophoton stuff.
Yeah.
But I've got a couple of different webinars in there, and then there's a learning section, so you can look through and see all the different trainings that are available. And you can contact me if you want to participate in anything. And then, of course, I have a shop, and you can see all the different devices. And at the bottom of shop, there's a whole bunch of instructional brochures, which will give you all the detailed pamphlets about all the different types of equipment. So I've tried to put a lot of things on there so you can really kind of delve in, and, at 11 o'clock at night when you're goofing around the internet.
Yeah, it's a beautiful website, and I'm so excited. I've, purchased your equipment, and I'm in the midst of studying as well. And it's yeah, you've just done a beautiful job putting all this information together. So thank you so much for being part of our summit and sharing your knowledge. I so appreciate it.
Well, thank you so much for welcoming me to participate.